and Children's Hospital in Cleveland.
Thank you. Good morning. For those of us in the science and health communities, we're more used to speaking with PowerPoints and laser pointers, so this is a different experience for me. But I'm really, really proud and honored and happy to be here with you today. I'm so grateful for all of you and the organizers for putting this together. As a pediatrician, Earth Day is really a perfect occasion, I feel like, to celebrate the contributions of science to our society. After all, stewardship of a healthy environment, which is essential for the health of our children, relies on scientific research, evidence-based policies and practices. For those of us in the medical and public health communities, we're accustomed to operating at the intersection between science, policy, and practice. We rely on basic science, clinical research, the open exchange of ideas, an informed public, and evidence-based policies to improve the health of the communities we serve. A few years ago, the Centers for Disease Control released a report estimating the impacts of a 20-year-old program to expand access to childhood vaccines. They reported that over the past 20 years, childhood vaccines had prevented 21 million hospitalizations, 732,000 deaths, hundreds of billions of dollars in direct avoided costs, and trillions of dollars in avoided societal costs. That is an incredible public health victory that's due to investment in research, evidence-based changes in our clinical practice, evidence-based policies, and most importantly, an informed public. And here again today on Earth Day, we're confronting another huge public health opportunity, and that is the opportunity to prevent the harms to health that climate change is already causing here in our community and all over the world. For example, here in our community, most of us know and love at least one child with asthma. In my practice, I take care of lots of kids with asthma. And just like with all children, I encourage kids to get active, play a sport, go outside, get out from behind your screen, and go have some fun. Well, the problem is that kids with asthma, who are doing what we want them to do in the summertime, they're outside playing, they're more likely to experience an exacerbation of their asthma symptoms on smoggy days. That's already happening, and climate change is exacerbating worsening factors that contribute to poor air quality in our community, including surface ozone. That's just one example of how climate change already harms the health of children in our community. In fact, the World Health Organization estimates that 80% of the harms to health caused by climate change around the world are borne by children under the age of 5. The good news is there's ample evidence we can do something about this. And that's why I'm thankful for climate science and public health research that can help us to understand and address climate change as one of the greatest public health imperatives of our time. Woo! It is critical to the well-being of our people and the strength of our society to invest in scientific education and research and for sound science to inform public policy. And that's why I'm grateful for this community of wonderful sponsors and supporters. Our lives here in Cleveland and Northeast Ohio are immeasurably enriched by our strong institutions of science, health, and education, which are well represented here today supporting our March for Science, along with all of you engaged citizens. I want to thank you for speaking up for the critical role of science in our society, which is so critical for the health of all of our people, but especially for the health of current and future generations of children. Thank you.
Isn't she fantastic? Yeah! Such a fresh way to think about climate change as it impacts the children. This often gets lost. There is a curb back here that you want to be careful you don't stumble on, so just be aware, look down when you're moving around. Also, we've been asked not to have signs along the edge of the Soldiers and Sailors Monument. Our next speaker, we have